Hello and welcome to this week's edition of Health Talk. I'm Peter Ndora, and today we'll be focusing on HIV and AIDS. Now, each year on the 1st of December, the world commemorates World AIDS Day. People around the world unite to show support for people living with HIV and to remember those who've died from AIDS-related illnesses. This year's theme, Global Solidarity, Shared Responsibility. Coming up on the program, producer Wandile Mufokeng spoke to a young lady born with HIV. She shares her powerful story with us. We also speak to the Executive Manager for Campaigns at Stakeholder Relations for the South African National AIDS Council, SANAC, about the country's progress in regards to HIV and AIDS. And we speak to a young man about living with HIV and how he manages this disease effectively. Then we get the facts about HIV and AIDS from an anatomical pathologist as we learn about prevention and how to manage the disease, but most importantly, treatment. And finally, we speak about the impact of COVID-19 with the pandemic on HIV. So let's start though with, as we usually do, with our senior producer Zama Budelezi, who will take us through the latest South African COVID-19 numbers. Zama, it's not a great story, is it, this COVID-19, and there's fears as we get into this holiday season that we might start to see more and more increases in super spreader events, and come January, who knows what the picture will be.
Yeah, we're following other countries, Peter. A very good morning to you and our viewers. COVID numbers are on the increase. Some countries are seeing the second wave of this pandemic. Globally, more than 63 million people have been infected. More than 41 million people have recovered, but sadly, more than 1.4 million people succumbed to the virus. South Africa is now the 16th worst affected country globally in terms of coronavirus cases. United States of America still leading with the infections. In the African continent, South Africa is still leading with infections. For now, let's take a look at the national COVID-19 statistics. More than 5.5 million tests have been processed in South Africa. More than 800,000 people have tested positive. More than 720,000 people have recovered. More than 21,800 people have died. Looking at the infections in the provinces, the numbers of new infections are on the increase, and 4 of the 9 provinces still reporting the highest numbers of infections, and these are provinces with big metros. Gauteng is still the epicenter of this pandemic. This province saw a 6% increase on the first week of the move to level 1 of the lockdown regulations. Gauteng Premier David Makura there saying precautionary measures to prevent the spread of the virus are not being followed. Let's take a look at these numbers. More than 230,000 people have tested positive in Gauteng. More than 135,000 people have tested positive in the Western Cape. More than 132,000 people have tested positive in the Eastern Cape. More than 129,000 people have tested positive in KwaZulu-Natal. Speaking on Morning Live this week, Health Minister Dr. Zweli Mkhize urged all of us to be cautious this festive season to prevent the spread of the virus. Let's listen to the minister.
We look at the numbers as they start moving up. We've been looking at the KwaZulu-Natal numbers. Are still very, very, very low, but the trend is not encouraging because it's slightly showing numbers that are slightly going up. Not enough to define them as anything yet, but indicating that we have to watch very closely. We issued that warning about Eastern Cape a few weeks back, and Western Cape. We are actually seeing now those numbers showing, full-blown increase. Now, we are worried about the festive season because what it basically means is that people are going to come together, they enjoy themselves, they don't use the sanitizer, they don't use masks, they share glasses, they share smoke, they share all those things. And in the process, they'll end up with a situation where it breaks up into a big, hotspot and outbreak. So we have to warn people about that. Now, during the festive season, everybody thinks that it's time to enjoy. that's when things are likely to actually get out of control. And the real risk is that by the end of December, beginning of next year, we'll have had so many of these super spreader events that in every one area where people have actually been complacent, the breakup happens. And when it happens, it begins to spread to more areas and it begins to go to different provinces. And when people go back to work during the beginning of the year, now you will see outbreaks all over the country, mainly because people would have come from wherever they've been, they were exposed to super spreader events, and then they're carrying the infection back to where they are working. And it actually is now a risk.
Stern warning there from the health minister. While it looks like the following provinces are recording the lowest numbers compared to provinces with big metros, the rate of infection is really picking up. Most of these provinces having passed the 20,000 mark. Let's take a look at where they are. More than 59,000 people have tested positive in the Free State. More than 34,000 people have tested positive in the Northwest. More than 31,000 people have tested positive in Mpumalanga. More than 23,000 people have tested positive in the Northern Cape. More than 18,700 people have tested positive in Limpopo. As we approach the festive season and people will be traveling and attending gatherings, just remember that the virus is still here. In fact, the increase in numbers of infections are a warning that we need now more than ever to take extra care to prevent the second wave of the infections happening in other countries. Let's continue to regularly wash our hands with soap and water, sanitize using sanitizers containing 70% alcohol content. We must also continue to wear a cloth mask that covers both our nose and mouth every time we leave our homes. We must continue to practice social distancing and ensure proper ventilation indoors. If you believe there is a chance you may be infected with the virus, call ahead to seek medical help from your healthcare provider or use the public hotline. The number is 0800 029 999 and alert them to your symptoms. Stay safe. Thank you so much, and back to you, Peter.
And Sama, thanks very much indeed. And I say it every week, the big thing for me is people wearing their masks properly. Cover your nose and your mouth. It isn't a chin guard.
And don't keep it in your pocket.
Exactly, absolutely. Thanks so much, Sama.
Thank you, Peter.
All right, so our thanks there to our senior producer, Zama, giving us those statistics. But do remember that as we observe and report on COVID-19 cases, the numbers often change and sometimes significantly, as you've seen over the past few months. So just bear that in mind. Remember, you can also be part of the show by asking our guests some questions that are on your mind, or you could simply share your views that you may have come to listening to what we're discussing on the program. And the number to call is 011 714 5861 or 5877. That's 011 714 5861 or 5877. We'd love to hear from you. Now, HIV-related stigma exists worldwide. Although it manifests itself differently across countries and communities, religious groups even, and individuals, HIV and AIDS-related stigma threatens to undermine interventions to prevent and treat HIV and AIDS. So our question to you this morning is, why is it still difficult to destigmatize HIV and AIDS? You can send us your voice notes or your video messages to our WhatsApp number, and that's 065 862 4548. That number again, 065 862 4548. And try and keep your messages to under 30 seconds so that we can share as many of those as we can. You can also catch us on social media, and our Twitter handle is @SABC Health Talk. Or you could even use hashtag SABC Health Talk. And our Facebook page, well, that's simply SABC Health Talk. And Health Talk continues right after this break. Stay with us. Welcome back. You're still watching Health Talk. A powerful story now. Sadie Brown is a 24-year-old young lady born with HIV, and she found out at age 14 about her status and started publicly disclosing it at the age of 18. She's used her status to educate other people about HIV using social media, and she shared her experience with producer Wandile Mofokeng.
Sadie, thank you so much for joining us, and welcome to Health Talk.
Thank you so much for having me.
Tell us about your status. How and when did you find out that you are living with the HIV?
So I found out at the age of 14. This was about 11 years ago, and I was at a school trip. So we went to the school trip. It was around Youth Day. So it was a Youth Day event. And my high school, the high school I was attending at the time, was invited to this event. I was one of the learners who were chosen to go represent the school at the event. We got there. There were people from this other organization, and they said, "Hi guys, we're doing free HIV testings. So if you'd like to have an HIV test, come through." So as a young 14-year-old who was not dating or having sex, I was so naive in thinking that, of course, my results are going to come back negative. So I just took the test for the sake of just making memories. And that's how I found out about my HIV status.
From then, how did finding out that you're living with HIV impacted you?
I was so naive in my thinking. So I kept on thinking, but I didn't really do anything. And I kept on saying that to that lady who was testing me, that, but I'm just 14, I didn't do anything. And it was until 6 months later then when I decided to tell my teacher, because I kept it to myself for about 6 months. So when I started telling my teacher, she took me home and we both told my aunt, who then said, "Listen, I knew about your parents, so you must have been born with this virus."
How easy or difficult was it for you to disclose your status?
I remember I chose Facebook to come out to the public and say, "Guys, I am living with HIV." And over time, I kept on posting for my own personal healing. But because now I was doing something that was deemed completely different, I started getting a lot of following. And I would get people who would inbox me their own issues and their own challenges with living with HIV.
Did they start treatment for you immediately, or did you have to wait until a certain age?
I honestly waited until I was like 18. I was very scared of starting treatment because, in schools, the whole narrative about, I don't know if it's still the case now, but back then the whole narrative about HIV and living with HIV meant that you get diagnosed, you spend the rest of your life on these pills that are meant to make you feel better, but they will also kind of make you sick because of the side effects, and then eventually you die. So I was quite scared of the side effects. And when I was told that my health had deteriorated to a point where I needed to get on treatment, I remember going on Google and searching the side effects of ARVs. That was where I saw things like my hair was going to fall off and my teeth were going to fall off. And I was just like, but I'm just 18. I don't want to feel like these pills are shaming me for being HIV positive.
How would you best describe stigma with regards to HIV in 2020?
Stigma with regards to HIV is the reason we still have people who are dying of AIDS because of AIDS-related illnesses. Stigma is the reason we still have children who are now called AIDS orphans. It is because of that reason that even I, as a 14-year-old, kept this thing to myself for 6 months. I was 14 and I kept this big, completely life-changing thing from everyone for 6 months because I was so scared of being judged and I was so scared of being viewed differently as a person living with HIV.
No, Sadie, thank you so much for your time and truly appreciate it.
Thank you so much for having me, Wandi.
What a powerful, powerful story. And it's stories like that that really should be helping us to destigmatize HIV and AIDS. It is a manageable and treatable condition. And we really should be looking at it completely differently by now. It's been 41 years since the first person was diagnosed with HIV and AIDS. All right, so we're going to take a quick break, and when we come back, there'll be much more right here on Health Talk. Stay with us for that. You're watching Health Talk. The 2020 World AIDS Day was commemorated yesterday globally under the theme Ending the HIV/AIDS Epidemic, Resilience and Impact. Here in South Africa, the AIDS Day theme was We're in this together, Cheka Impilo, a clarion call to every South African to make the right choices and ensure that they know their health status. The event was held at the Itereleng Community Health Centre at Dobsonville in Soweto in Johannesburg. And to continue with the HIV/AIDS conversation, we're now joined by the Executive Manager for Campaigns and Stakeholder Relations at SANAC, Reverend Zoitoao Nevutalo. Thank you so much indeed for joining us and welcome to the programme.
Thank you. Thank you, Peter, and to your listeners.
All right, so it's been 41 years since patient zero in terms of HIV and AIDS in the world. Not quite sure when patient zero was in South Africa, but it was quite a journey for us here. And I just wonder, as we got to World AIDS Day yesterday, do you think we've made great strides in combating HIV and AIDS?
We definitely have. We definitely have. And I think it is just a matter of time that we're going to see the end of this and relegate it to the textbooks, history textbooks. It is just that we are not getting there fast enough. And I always say that if you have got an affliction, even if there is progress being made, you want it to be a little bit much quicker because, you know, it's an issue that we would really, all of us would wish to live without it.
All right, we have certain targets that we're trying to reach. One of them is eradicating HIV by 2030. In the meantime, there are targets like the 90-90-90. Tell us about that. What is it and how far are we in terms of achieving it?
In 90-90-90, as you are aware, Peter, that HIV is not a South African epidemic, it's a global one. Even though in South Africa we carry the biggest burden. So the United Nations, through a lot of collecting evidence and research, looking at current interventions without a cure, they came up with this 90-90-90 strategy, the 390s, which what they're saying to countries is that if in your country you ensure that 90% of the people in your population are tested and they know their status, and you ensure that out of those who test positive, 90% of them are put on treatment, and then ensure that out of those who are on treatment, 90% of them have viral suppression. Now, Peter, I think it's important for people to understand that the reason why they're saying this is because when people are on treatment and they are virally suppressed, that is also a form of prevention because they are not likely to infect other people. So those are the 390s that we've got. In South Africa, we are doing very well in terms of the first 90. We are not doing well in terms of the second 90, and it is a big issue. In other words, people who know their status, who are HIV positive and are not on treatment, we have got what we call a treatment gap. And one of the objectives of Cheka Impilo campaign is we were trying very hard to ensure that we can actually get 2 million of them on treatment. So the third 90 also in terms of viral load suppression, we are doing much better than the second 90. I think we are at like 88%, but we are not doing as well, you know, as we would like to do in terms of the 90-90-90 targets. And it is said that if a country does that, by 2030, we will end AIDS. It doesn't mean AIDS will not going to be there or people are not going to be HIV positive anymore, but it will be in such a way that it will be completely dying down. So we're not going to have new infections because the biggest difficulty is when we keep on adding new infections to the people already infected at the moment. If we could stop that, I think it means that we can be very closer to the goal of ending AIDS.
We're making great strides, as you said, in many areas. And I just wonder, though, in terms of behavior, we seem to be still struggling, and it's a challenge to change people's behavior. What's holding us back, do you think?
Well, that is a puzzling issue. And a lot of researches go into this. I can go back to a tweet which I saw in the Minister of Health this week, indicating that one of the difficulties in terms of HIV and AIDS is the linkages between HIV and AIDS and substance abuse. So as you know, in South Africa, we seem to really love, our bottles and our substances. That is actually one of them. The second issue is that, as you see, this is 16 days of activism. In South Africa, we actually have got a lot of gender-based violence. So that is another issue which is actually complicating this, because for some people, infection is not really something that they go out there voluntarily looking for fun, but sometimes it is something that they get coerced, under pressure, under threat, or being assaulted and so on. So there are a number of issues, but I think one of the issues as well is information. Peter, I'm very happy that you are running this show, because the media can assist us a lot. When we look at the Check Impilo campaign, it's not a health matter. It's not something that must be relegated to doctors or to health professionals. It's for all of us. But the starting point and the biggest program of Check Impilo, it's information, education, and communication. A research which has been carried out in South Africa by the HSRC showed that even during this time of social media, the knowledge on HIV, STIs, especially by young people, has actually gone down. So it means that even though there's a lot of information out there, people are not assimilating it. So something that we need to actually keep up and make sure that our people are well informed. They must be well informed about the state of the epidemic. They need to be well informed about the interventions, programs that are there to be able to assist them. Let me just give you a quick example, Peter. We have got what we call a pre-exposure prophylaxis program, which is fantastic and it works very well. And it's actually prescribed primarily for young women, especially if they've got a risky sexual behavior. But I have been trying to ask young women, every time I meet a young woman, I ask about PrEP. And I can tell you, as I'm sitting with you now, I've never found a young woman who can tell me what is PrEP all about.
Right.
So I also, as communicators, it might be anecdotal, but it's not known. These programs are actually not known, whereas they can save life and help a lot of people.
All right. So we've also made progress on the science field. There was a time when you had to take a cocktail of drugs and they had severe side effects. And now we've reduced them sometimes to just one pill with less side effects. That's the one thing. But we're also hearing that there have been breakthroughs in terms of HIV prevention and coronavirus vaccinations. One being a long-acting injectable HIV prevention drug, and second being a vaccine candidate with a 90% success rate against COVID-19 infection. Talk to us a little bit about these developments and what that might mean in terms of fighting this disease.
Yes, as I said to you, I think we need to take our heads off to the scientific community. We know that they have not come with a cure. They have not made as much strides as we would love them to do. But I can tell you that within the available knowledge and information, they are trying very, very hard. I was just talking to you about PrEP, for instance, which is a form of prevention itself. But just a few weeks ago, I've been watching, these researches and results coming up. I can tell you that one of the most exciting things is this injectable, because it says that, actually they've run trials and it has been found to be very effective. If it can be rolled out, Peter, I think very soon I might be without a job.
Wow.
Because, and that's what I look forward to it. Because imagine if all these young women would go to health facilities where they go anyway at the moment. A lot of them go to get injections for prevention of pregnancies. But if they also get an injection and they are negative, they get an injection that prevents HIV, then all these things about the impact of gender-based violence, where they cannot negotiate sex, is actually going to go out of the window. So this, the scientific community is really making a lot of successes, even though we would have loved also the issue of the vaccines. Personally, this is my personal view, and it is shared by the SANAC civil society sectors, is that the resourcing of the HIV/AIDS response has not been at a level that we have seen on the COVID response. And much as we would love the COVID vaccine to come upstream, I think it might be, for some people, it will be a little bit of an indictment that we could quickly get to a COVID-19 without an HIV/AIDS vaccine. But a lot of that, of course, the viruses are not the same. But many people are saying that we are reaching a stage where a lot of donors, a lot of people who have got resources are getting fatigued, are getting tired, even though we have not reached the end of HIV and AIDS.
Very powerful thought to leave this conversation on. Thank you so much indeed for joining us. And as you say, I think we need to keep on having these conversations to make sure that everybody's aware. Reverend, thank you so much for your time.
You're welcome. Thank you.
All right, that's Reverend Nevudalo from SANAC speaking to us about progress that's being made in terms of combating HIV and AIDS. After the break, we continue our discussion on HIV and AIDS as we speak to a young man living with HIV. Thereafter, we'll be chatting to an anatomical pathologist. Stay with us. Welcome back. You're watching Health Talk. Now, receiving a diagnosis of HIV can be a life-changing event, but HIV does not equal death. Most people with HIV live long and healthy lives if they get and stay on treatment. Starting antiretroviral treatment as soon as possible and sustaining it as part of your everyday routine is the best way to ensure that your immune system stays strong. The survival rate for HIV-positive people has dramatically improved since the start of the HIV pandemic. To talk to us a little bit about living with HIV and how he's managed it, we're now joined by Sibonelo Dube. Thanks so much for joining us and welcome to the program.
Thank you so much. I'm honored to be a part of the show.
All right, Sibonelo, I guess for everyone there's an amount of fear that comes with testing, and some people don't want to test because they're scared to find out what might come. What would you say to people who are fearful of testing, and especially if they find out that they're positive? What do you think they need to be told so that we encourage more testing and that people are not fearful of a positive result?
Okay, first of all, I'd like to greet all the hood called Clermont Quatabega. My advice to the people, I will say HIV is not a death sentence. So like me, I'm the young driven guy who's been living the HIV for 16 years now. And do the test because everyone must go and do the and test for HIV positive or for HIV virus. Yeah.
All right. So how has your life changed, if at all, living with HIV?
Life has been a journey with ups and downs. But I'm a survivor. That is why I started to preach or to make awareness, to tell people that it is not a death sentence. You can live longer as long as you take to the clinic. And people talk about these things, you know.
All right, so Bonella, we're struggling with the connection, so we're going to try and ring you back just now, so stand by for that. In the meantime, I want to introduce Dr. Nontobeko Mbata, one of our regulars on the program, an anatomical pathologist to help us with this discussion. Always good to talk to you. Thanks so much for joining us on the program.
Hi, Peter. How are you?
Yeah, not too bad. Do you know, I was surprised when I found out that, you know, HIV has been around since, it's probably longer, but patient zero was 41 years ago. And we've gone through quite a lot over time. As a medical practitioner, what do you find is still the biggest challenge in terms of dealing with HIV in the modern day?
I think the biggest challenge for me that creates a lot of problems is stigma.
Right.
And I feel like until we deal with stigma and how people understand and relate to HIV, we're not going to go far. Because the stigma is what scares people to test early, even when we see symptoms. It's the stigma that makes people not even consider HIV sometimes. Because we sometimes feel that certain people can't have it. Therefore, we kind of exclude or think that it doesn't affect a certain group of people. So for me, I think the stigma, because in terms of advancements in medicine, people who are diagnosed early and go on treatment early, they actually live a healthy, normal life. So for me, I think stigma is the biggest problem.
All right. And as you say, we've made such great strides in terms of treatment and managing HIV and AIDS. So let's talk about the process. Somebody's just found out that they're HIV positive. What should they be doing next?
Okay, just finding out would depend on where the test was done or how the test was done. As we know that there are kits available commercially. So if someone has tested at home or has tested in a clinic or a hospital, but good counseling is one of the best things, because there's a sense of impending doom when one finds out that they are HIV positive. And there's a lot of questions, there's a lot of denial, and a lack of understanding sometimes of wanting to know, where did I get it? When did I get it? Why did I get it? And the self-judgment. So a lot of support and a lot of counseling is important. The other way that people get diagnosed with HIV is the way that we don't like when people are diagnosed when they are sick. So it's a diagnosis that's not really expected, but then because someone is not well, they get tested and then they're positive and it's a shock. So during that time also counseling is good, but more than any other thing, it's to also do Cd4 counts to see what the acute medical need is at that time. Meaning, should or does the patient require to go on treatment immediately, and we should then sort out all the other associated problems after that.
All right, we'll talk a little bit more about treatment and procedures like that in a bit. But I'm just trying to get, perhaps let's start even with prevention. What is still the best way to prevent getting HIV? Because I guess that's where we need to start, really.
So we have to always remember, because unfortunately with HIV, we always think of unsafe sex practices first, and it's not wrong. And it is one of the main contributors, but we must also in mind remember that I don't know the percentages currently, but people have gotten HIV from transplants, the handling of someone sick at home without knowing, or getting into contact with someone's fluids without being aware. So we have to look at that in like a comprehensive list of those problems. But yes, unsafe sexual practices are the main thing, and that's the reason that we're currently struggling with right now to sort out is the unsafe sex practices. So if we could improve on the way we think and practice our practices around safe sex practices, I think we could go a long way. And I think the struggle is still there.
Right, and then as you say, Cd4 counts. Just explain that for us a little bit, because I think sometimes we use these terms and we assume everybody's on the same page.
So a CD4 count, when the virus gets into the body, because it's a foreign object, the body obviously, just like any other organism, like a bacteria or a parasite, any organism that goes, a foreign organism that goes into the body will try fight it. And HIV is not special. So the soldiers or the part of the body cells that fights HIV is called Cd4 count. But at the same time, this is the cells that the HIV attacked. So what the HIV does, it wants to create, it almost like wants to create an environment in your body to exist in peace. And to do that, it fights the soldiers that fight itself so that it can exist on its own. So it fights these CD4 count, and then this decreases your immunity because CD4 count cells protect us from a lot of other infections.
All right. So I guess with that kind of environment, COVID-19 is a problematic condition to get.
Sorry, Peter?
I was just saying, as you talk about CD4 counts and immunity, in a global pandemic such as COVID-19, it's a problematic a pandemic to have for people who are HIV and perhaps are not on treatment or don't know their status.
So the initial feelings on what COVID-19 or the initial thoughts on what COVID-19 was actually going to do in our country, because we have a concurrent, not pandemic, like an epidemic of HIV, we initially thought that it's going to hit us very hard. But because we've had such a successful ARV rollout program, most or a lot of people have normal immunity. Therefore, when infected with COVID, have not suffered great side effects. So there hasn't been as great an impact as we thought there was going to be. But some of the primary reasons are because we have a lot of people who are HIV positive on ARVs with normal immunity. What then it does, I've tried doing a bit of reading, but also in the people who are not on ARVs, sometimes we have to look at the complications related to COVID as those ones related to the actual virus or those ones related to the associated treatment. Because with COVID, we also do use steroids, and steroids can diminish the immunity of a patient who's infected with HIV. So those are the things that we look at, and that's where the associations may be. But there hasn't been a great impact the way we anticipated initially.
All right. Nontobeko, we're going to take a quick break. And in fact, let's listen to Sibonelo for a brief moment, and then we'll take a quick break and then come back and continue that conversation with Dr. Mbata. But Sibonelo, thanks so much for coming back on the line. And just before we lost you, the question that I asked you was how your life had changed with an HIV positive diagnosis.
For me, it didn't change at all because I believe I'm a strong person. What I did when I found out I'm HIV positive, I immediately tell my mom, tell my brother, and the closest friends, and then I put it out on social media, and it started trending. So for me, it has been nothing. But yeah. I told myself that I'm not defined by my sickness, but the strength and courage does define me.
All right. I mean, you sound like a champion more than just a survivor. How hard was it to disclose your status beyond your family to friends and to people around you?
You know, the funny thing, it wasn't hard at all. It wasn't hard at all. And for me, I try by all means to break the stigma that comes with the virus in a friendly way. I always post videos on social media encouraging people to go to the nearest clinic and check, making awareness in the community, all those things. Yeah.
Tell us about your treatment journey. When you first found out, what happened, and what's been your maintenance program?
The treatment, I've always received complaints from the people who are studying the medication, complaining about the bad dreams and stuff. And you know what I always tell them? I tell them that it is a part of taking the treatment. So it's gonna make you maybe busy for like 2 weeks or 3 weeks, but in a while you're gonna be okay. You're gonna be all right like us. So there's no transmission. There's more life, more than HIV virus. Here we are living a testimony.
And socially, how has that impacted? Because you want to date, you want to meet people and have partners. With HIV, how is that journey?
That journey, to be quite honest, it's been on and off. Some people, they are scared because they have less knowledge or less information. So other people, they will turn you down because you are infected. But you know what I've always do, even when I approach you, I tell you first time that I'm HIV positive.
Right.
And there are medication. We have PrEP and we have PEP. PrEP pills. So PrEP is those are pills. You can go and take them at the clinic if you are facing an HIV positive person. You must take them like for 30 days so you never get infected.
Okay, so honesty is important, and some people will react the way that they do, but this shouldn't hold you back. I get a sense you're saying.
Yes.
Swanela, I wish we could talk to you for much longer. Unfortunately, we don't have time, but thanks so much indeed for sharing your story with us, because I think a lot of people will get great benefit from that. Thank you so much.
Thank you so much for the opportunity. But people that can follow me on social media, I'm Seth Bonello D on Facebook, Seth Bonello D, and my email address is seth1@gmail.com, and on Instagram I'm bo_HT.
All right, thank you so much indeed, my brother.
Thank you so much.
Okay, so living positively with HIV, it's not a death sentence, it's just a change of life and dealing with things, but one that can be managed. Now, after the break, we turn our focus to the impact of COVID-19 on HIV as we continue with our discussion with Dr. Nontobeko Mbata, who's an anatomical pathologist. Stay with us. Welcome back. You're still watching Health Talk. Now, a high percentage of HIV-positive South Africans were missing their clinic appointments to collect their medication because of the then strict lockdown regulations. The country has also seen a drastic drop in HIV testing due to the coronavirus infection fears at healthcare facilities. Recent modelling has estimated that a 6-month complete disruption in HIV treatment could lead to more than 500,000, that's 500,000 additional deaths from AIDS-related illnesses. We're going to continue to discuss that with Dr. Nontobeko Mbata in a few moments, but first let's catch you up with some social media tweets that you've seen on the program. Doppelganger says, many HIV-positive persons are functioning members of society and we demand to be treated with respect. What kills us is not the disease on its own, but the fear that society's discrimination has brought upon us. Break the stigma. Yeah, that's a theme that keeps coming through. Cocoa Butter Choc says, posting your negative HIV results defeats the whole purpose around its stigma. Encourage people to know their status, that's all. Good point. Thanks so much, Cocoa Butter. Twerkuri Retrograde says, good morning to all the folks living with HIV. No, you didn't deserve it. What you do deserve is the exact same love, admiration, and respect as always. Hell, I'd say even more, because it takes a lot of bravery and courage to face stigma and misinformation. I love you all. Thank you so much, that gain games. Pang Pang OFC says people living with HIV do not only face physical and health issues, they also encounter psychological and social conflicts due to the stigma behind HIV. This should not be the case. All right, so those are your social media thoughts. Thanks so much indeed for sharing those. Let's go back to Dr. Mbata. Nontobeko, I think you're so right. When we started this conversation, you said it's stigma. It's how we approach and look at it. And I suppose the drama really is that it's predominantly through sexual activity. And for whatever reason, society has always looked at upon as something that shouldn't be talked about, and that's quite sad. But let's talk a little bit about treatment now. We're in 2020, going into 2021. Things have changed dramatically over time. So take me through a process. You first said that we count our Cd4 counts, and then there's an initial treatment regime, and then there's one of maintenance afterwards. What is that process? What are we looking at when we first diagnose? And then what do we do for the rest of our lives?
Okay, Peter, just one more thing before we move on to treatment that I wanted to say was that it's up to each and every one of us to embrace our loved ones, our friends, all our acquaintances when such things hit us. We, the people surrounding these people at a time of need, are what create the problem. And we must not all forget that just because you don't have HIV today doesn't mean you will always not have it. I'm not threatening, but I'm just saying life turns, and it turns slowly, but we need to be very supportive and loving of every one of us. I'm sure all of us know someone who's infected that's very dear to us. Yeah. Now, moving on onto treatment, there are guidelines. So there are South African guidelines which have actually improved over a few years, and currently they actually guidelines that I'm very proud of. Like I said to you, there are different entry points at getting medication, and we have to look at the entry points for children, for example, and for adults. And there are guidelines that give doctors direction as to when to start treatment and what treatment to start. So there are baseline drugs that are first-line treatment that can be initiated. And these are the drugs that are mostly given to everybody if they don't have certain complications. The complications we look at include things like if the pregnancy, we have to adjust the drugs for pregnancy. We have to adjust drugs for patients who have renal or liver associated liver complications. So those are mostly like second line, and when we have things to adjust, but there's first line drugs and then there's second line. And then after that, once a patient has been initiated, then they get monitored. And in the monitoring phase, this is where we expect the Cd4 count to improve, and we expect the viral load to go down. The viral load is the amount of virus that is circulating in the body of a patient. If you are able to block the viral load, it gives the body time to recuperate and increase the Cd4 count. So these two numbers are indirectly proportional. And then after that, we then also have to look at what are associated opportunistic diseases and infections that a patient have that we need to add the treatment of on top of the ARVs. So the common ones are things such as TB, fungal infections of the skin, meningitis, pneumonias. There's a lot of list of all these infections that we then have to add additional treatment on. Then we have other drugs that are used to prevent certain infections, such as we use Bactrim, that is used to prevent a certain type of very severe pneumonia in the lung. So the treatment for HIV is very complex. It doesn't start and end at ARVs, but you can't do it without ARVs.
All right. Dr. Nontobeko Mbata, always great talking to you. Our conversation is sadly always too short. We're going to have to leave it there for this week, though. We'll chat again soon. Take care.
Soon. Thank you, Peter. Thank you, everybody. Bye.
Bye-bye. All right, and sadly, I mean, there's so much to talk about, so many issues to deal with, but Please get proper advice from medical personnel. Don't rely on what you see on social media from people who think they know what they're talking about. Talk to professionals. And it's not a death sentence. It's treatable, it's manageable, and you can live long, healthy lives. But it has to start with you knowing your status. And that's where we finish for today. Thanks so much indeed for joining us. Have a great week, everybody. Stay safe.